how do we think about where functional nutrition adds to the functional medicine model? What I want to talk about today are the ATMs in functional medicine and functional nutrition. The ATMs stand for the antecedents, the triggers, and the mediators. And what this really does is invite us to consider the client or patient's story in relation to their physiological signs, symptoms, and diagnoses. So a person isn't just their lab markers or their diagnoses or their symptoms. They are a person who has those lab markers, those diagnoses, and those symptoms. And when we look at the person through the ATMs, it helps us to see a broader picture. Our antecedents are how we were born, the order in which we were born, our parents' and grandparents' history with health and disease and what they've lived through. Our triggers are all the things that we've experienced in our lifetime. And I don't mean triggers in the way we talk about it today. I mean anything that's acted as a bit of an insult to your physiological terrain. So that can be a difficult job or a death in the family or pregnancy or graduate school or a big move or the loss of a job. All the things in life. It could be a surgery or a dental procedure or a diagnosis, yours or a loved one's. These are things that act as triggers throughout our lifespan. Our mediators are the things that we know help us feel better or make us feel worse. And the more we know about our mediators, the more agency we have in our health. And I like to say, as functional nutrition counselors, the more we help people understand their mediators, the more empowerment we are giving them in their own healthcare. So why does this all matter? Why aren't we just focused on that organic acids test or that Dutch test? Well, all those things exist in a context, and that context is the human individual. And the ATMs, they help us to really see that this is a person who is experiencing these things, and they help us to understand our way forward, because we're not just treating a marker or diagnosis. We are making recommendations and tracking for an individual.